Hi, my name is Dr. John Shim, and I want to discuss posterior lumbar fusion. By now, you have already tried non-surgical treatments and have decided to move forward with surgery. Posterior lumbar fusion surgery is offered because your pain patterns and physical examination matches the findings on your diagnostic studies. The indications for posterior lumbar fusion is multiple. To summarize, your surgeon has determined that you would benefit by having two or more vertebral bones of your lower back become one bone. A fusion is a process by which a surgeon makes bones in your body appear to be broken, so your body naturally responds by attempting to unite the broken pieces. A posterior lumbar fusion means the incision is made to the lower back and the bone edges are roughened to create the broken bone environment. Various plates, screws, and cage devices can be used to stabilize the bones while healing. Fusion may be accompanied by removal of bone or disc pressure on the nerve. Of course, I'm simplifying the process. For the surgeon, there are many nuances that need to be considered. Experience helps when planning the operation. Surgeons have many options when planning a posterior lumbar fusion. Surgeons may choose not to utilize all options when planning a specific individual's operation. The more complicated posterior lumbar fusion technique is called the posterior interbody fusion. For this standard technique, the same midline incision is used for the lumbar laminectomy. If there's a bone spur or a disc herniation, they are removed. For the interbody fusion, more of the facet joint must be removed to allow adequate exposure to allow more aggressive removal of disc tissue. The classic technique requires removal of bone and disc material from both sides. Care must be taken to protect the nerve sac during insertion of the interbody fusion cages. Once the cages are placed, the additional space around the cages are packed with bone material that will promote bony healing. Once the interbody fusion cage devices and bone grafts are placed, the spine must be stabilized to allow fusion. Use of screws and rods to achieve stabilization is a very common technique. Care is taken to place the screws in the strongest part of the spine, called the pedicles. Once the screws are placed in the bones, they can be fastened and linked to one another with standard rods and bolts. The side wings of the vertebral bone, called the transverse processes, are roughened, and additional bone graft is placed along the sides of the vertebral bones. There are variations on this classic technique. Some surgeons will utilize two smaller parallel incisions that allow less exposure, a less invasive approach. Some surgeons will place one interbody cage in an oblique direction instead of two separate cages. For some situations, the most classic fusion technique of roughing the bones and not inserting screws or cages, but using a back brace may be the best option. Depending on the situation, most patients are admitted to the hospital for a few days, and many will be wearing a back brace for a certain period of time. Posterior lumbar fusion is an option for certain patients. It has its role and can provide significant benefit. This is the basic animation of the posterior lumbar fusion operation. You should discuss your individual concerns with your surgeon. This is Dr. Shim, and I hope this video helped you understand the posterior lumbar fusion operation. Thank you.